West Hills Hospital nurses who claim they're understaffed and working with a dangerous lack of personal protective equipment during the COVID-19 crisis staged a protest Thursday in front of the hospital. The employees, represented by SEIU 121RN, say the situation is endangering the lives of employees and patients. They also allege the Los Angeles hospital, owned by the Hospital Corporation of America, has attempted to silence nurses who brought the issues to light. Nurses in the hospital's COVID-19 units say they're caring for more patients than they can safely handle. More RNs are desperately needed, they say, while many of their colleagues have been furloughed. "We never had a problem with nurse-patient ratios until the COVID-19 pandemic hit," said Yolanda Tomanak, a critical care nurse at West Hills. "We're supposed to be protected under the state's Title 22 regulations, which means a nurse in the intensive care unit can't have more than 2 patients at a time, but now it's sometimes 3. Nurses in the hospital's telemetry unit say they are saddled with the same problem. "They're supposed to treat no more than 4 patients at a time but are frequently in charge of 5, Tomanak said. "Nurses are missing breaks and lunch periods as a result," Tomanak said, while protective gear to guard against COVID-19 is in short supply. Protective gear, nurses contend, is being reused to the point of cracking. Tomanak said nurses are supposed to wear N95 masks with a hood called PAPR placed over the face and mask that has oxygen blown into it. "They don't have enough PAPRs to cover the amount of COVID-19 patients we have in the hospital, and some of them have been used so many times they're cracked," she said. "Many nurses only have access to a surgical mask," the union said, and those lucky enough to get an N95 mask, designed for a single trip into an infected patient's room, are being told to use one for an entire week while treating multiple patients. In a statement issued Thursday, the hospital said the pandemic has strained the worldwide supply of personal protective equipment, including masks, face shields and gowns, a challenge that is shared by many hospitals. "West Hills Hospital is doing everything in our power to ensure safety, including securing additional PPE for current and future needs, enacting a universal masking policy, providing scrub laundering service and housing options for all colleagues caring for COVID-19 patients," the hospital said. Nurses at the hospital still fear they may be inadvertently spreading the coronavirus to uninfected patients. When Jonna Porter found out that the administration at West Hills planned to convert her 5th-floor nursing department into a COVID-19 unit, she didn't think the hospital was providing enough staffing, so she posted a March 24 plea for donations on her personal Facebook page.